This is Trainer Nick with AHCP. I am joined by Robin Devenbrock, who's with us with Pivot Health, and she's here to talk product positioning and market positioning, and just really kind of starting us off here as we're getting started into looking at another open enrollment coming in a couple months here. Obviously, Pivot's one of our big carriers in our supplemental market, especially for our short-term product here. And so we brought Robin on, again, talk product positioning, market positioning, and just kind of let us know what's new and what's happening at Pivot. So Robin, thank you so much for joining us. We're excited to have you here, and I'll give you the stage.
Great. Thank you, Nick. Thank you, everybody, for being here this afternoon. I am, like Nick said, going to go over kind of where our products fit best. I know that you have a lot of products in your portfolio and you have a lot of choices. And I'm hoping that just kind of explaining how we brought our products to market and the thinking behind each product development and where we thought it fit may help you when you're out there talking to your clients. So real quick, just to give you a kind of background or history of Pivot Health. Pivot Health came into the market in 2015. That's when we sold our first policy. Pivot Health is not an insurance company. We're a marketing company, product development company. So we take carriers' paper and we make a product and we bring that product to market. Our product focus is alternative individual insurance. So we sell short-term medical, fixed benefits, ancillary products, a lot of products that you're probably used to or may have in your portfolio today. When we first started, we were a strict direct-to-consumer play. We weren't going to use brokers at all. We were just going to be direct-to-consumer. That quickly changed. And because we felt like we needed to get our product out fast, we went out to brokers, FMOs, big agencies to sell our product. We quickly became a leading product for a lot of agencies. And the reason that is because as the market, this crazy market that we're in today, this individual insurance market, as it changed, we were able to, excuse the pun, but we were able to pivot to be able to provide products to fit that changed market. So maybe it wasn't a brand new product development. Maybe it was the way we administered the product. Maybe it was our durations that we had in our product. So, when ACA regulation took short-term medical and they capped it at 90 days per policy, we were the first company to come out with that 4x90-day policy. So you had 4 90-day policies that gave someone 360 days of coverage. So again, we were easily able to kind of change our gears to bring a product to the market. And then we take agent feedback very seriously. And you're in it every day. And so we took agents' feedback, whether it was through surveys or just chatting on the phone, and we came up with different products. I'm going to talk a little bit about our core product. That was a product they said, hey, you need a light product that has access to a network. We came out with Core. We wanted that product. We thought that product would be good for that, younger generation. Then the agents turned around and said, okay, great. You've got a low product and a medium product. Now you need a high level product. You need the Cadillac of all Cadillacs of products, strictly PPO, strictly network products. So we launched Quantum. Then we heard, the Quantum's good, but we need something in between. And then we launched the Epic, which is very high in preventative benefits, wellness, and 100% coinsurance plans. And then we extended our plans to 3x364. So now you can get 3 years of coverage. So we're constantly launching products based on the market need and on the agent's feedback. Our product suite, these are our proprietary products, Pivot Health's products. We have our short-term medical. Again, that's a limited duration, right? The policy absolutely has an end date to it. We have an array of plan designs. So you can customize a plan to fit any of your client's needs or budget. We have plans that have doctor office visit co-pays, utilize national networks. We have plans that have what's called open access. And I'm going to talk a little bit about that because that really is what I like to call our special sauce. And that makes us a little bit different on a lot of different ways. Then we have an anchor plan. This is a fixed benefit plan. So there's no deductible, no coinsurance. It has an increasing hospital confinement benefit. We blended the injury and illness benefits as one, so it's very easy. It's not confusing. There's no lifetime maximum, and there's a patient advocacy service on this plan. Actually, it's on all of our plans. A patient advocacy service, which helps find a provider. And then also on the back end, it helps negotiate your out-of-pocket expense. So if you have a large deductible and you just can't afford that bill that went towards that deductible, they'll help negotiate that bill with your provider. So really, really nice. It's a permanent plan. So it'll renew every single year as long as you pay your premium. This is not a durational driven plan. We have dental and vision. We have some plans that have no waiting periods for any services. Basically, it's a progressive plan, so it increases in benefits second and third year. We have all of our plans, preventative exam, it's covered at 100%. We have child ortho on one plan. We have optional vision through VSP that you can add to all of our dental plans. And we also have like a value plan, which is just preventative and basic, perfect for the younger people that don't need major services. And then we have a supplemental product, which is a package critical illness, accident, hospital indemnity, and AD&D, which can be added to all of our plans. It's guaranteed issue, and the cash is paid directly to the member. Or not really cash, but the benefit is paid directly to the member. This is our product portfolio map. So when you're looking at this, you're like, whoa, you're almost in every single state. Well, we are, but we're with different products. So if I was going to focus on the colors in this map, I would look at the dark blue. I would look at the green, the light blue, and the orange. Those are our really states where we have most of our products, and you're going to have a lot of choice there. So who are the candidates? So you're thinking, okay, who can I take these products to? Our products have not changed, even though the market has changed, even though subsidies have changed. That made it affected our market a little bit. Our core market has never changed. And the gig economy worker is a perfect market for us. A gig economy is basically a freelancer, a 1099. And, this gig economy was an economy that was on the rise before the pandemic. When the pandemic hit, there was a surge of people that went to freelancing, right? They lost their job. Maybe they left their job or they didn't want to go back to their job. And so they decided to freelance. They decided to do some gig working. If you're looking out there and you hear in the news about, employers are having a hard time hiring full-time people, it's because everyone got a kind of a taste of working for themselves and they liked it. Today, 36% of the US workforce are in that gig economy. And it's expected by 2030 that 50% are going to be in that gig economy. So today, that 36% represents 56 million people. They're making good money and they don't have employer-sponsored insurance. So they are an excellent market for you to take these products. Early retirees. We hear all the time that people, 10,000 people turn 65 every day. Well, our products, we made it a conscious effort to make our products very price conscious for this age group from about 60 to 64, that pre-Medicare market. We wanted our products to be good for them so that they would be able then to go into Medicare. In 2040, everyone will be 80 million people will be over the age of 65. So there's a vast many people, 10,000 people are turning 62, 63, and 64 every single day. And that's a great market for us. People that don't want network restrictions. If you go to ACA, you have major network restrictions. You go out of network, you don't get any benefits, basically. There are other plans like that that have a strict network plan. We have plans that you can use any facility or any doctor. These plans are great COBRA alternatives. I had an agent call me and said, oh my gosh, I had someone who was going to go in COBRA. It was too much for them to pay. Then he was going to do the ACA. That was too much for him to pay. I did a short-term form because he only needs it for 6 months, and I saved him $400 a month. So, it's things like that, just kind of figuring out which plans are good and where. And then kids aging off their parents' plans at age 26. 41% of postgraduates are now freelancers. That's our world. That's where everybody is going. And that's a great market for us. People that get divorced, unfortunately, most of the time, the women are left without insurance and they need an affordable option. College students, we cover college athletic injuries as any other illness. Only short-term medical plan that does that. We love college kids. People moving to a new state, they need coverage in a new state. Our plan is portable. Our open access plan, you can take it wherever you go. And then I thought this was pretty interesting. People on waiting periods, yes, we sell the longer term durations, but sometimes people just need a policy for 30 days or 90 days. And so we have that, that flexibility to do that as well. And they want something cheap because, I'm only going to have for 90 days. I'm not going to get sick in those 90 days. I just need insurance in case something happens. So we have those plans. And I thought this was an interesting stat that the average individual holds 12 jobs between 18 and 52. That's a lot of waiting periods where these plans could work. So again, our short-term product portfolio, we kind of have 4 chevrons of plans. Our core plans are, we kind of created these plans for that younger age segment, younger, and I'm using quotation marks, but you can't see me, invincible market, because these have very low deductibles. They have doctor office visit copays. They have access to the First Health Network, but they have limited hospitalization benefit. So it only pays up to a certain amount per day. And then after that, it's not covered. So this is really for the person who says, I don't need hospitalization. Yes, if something happens, I want to know I have some coverage, but all I want to do is go to the doctor if I don't feel good, and I want to be able to look it up on the network. So this is our light plan, and this is for that person that just really wants it for a short period of time and just really was looking for those doctor office visit copays in a network. Our classic plan is that has one of our best selling plans within that plan design. It's a choice plan with a $5,000 deductible, 80-20 $1 million max. And why that's so popular is because for the price that we have it and the benefits, it is an excellent option. They have the classic plan. There's an array of plan designs, and this is the plan that you really could customize to fit any client's needs or budget. This plan is all open access. So with this plan, we call it reference-based pricing. They can go to any network or any provider. The Epic plans, these are great plans too. So we took the Epic plan, we said, okay, if you want open access, you can have the Epic base. If you want a PPO plan, you can have the Epic PPO. Both plans have preventative coverage. Child immunizations are covered at 100% on both plans. There's an optional RX copay plan, access to the Cigna Health Network on the PPO plan, and then an optional accident rider. Then the quantum plans, remember I said these are your plans, these are your rich plans. These are great COBRA alternatives because they look a lot like group benefits. That's how rich they are. And these are true PPO plans. So there's in and out of network benefits all through the Cigna network. This just gives you an idea kind of the pricing of the different plans. Not going to go over every single benefit, but you'll see the core is going to be a little bit lower, choice, and then the deluxe, which is another classic plan, and then the Epic base. So you'll see the Epic base is really well priced for the benefits of the preventative and the wellness benefit that's on there. It's a great product. So very nice to put on the spreadsheet. So what makes our short-term plans different? Again, all the plan designs we have, the extended durations that we have, 2x80, 2x180, 2x364, and 3x64. There's no additional underwriting, no new pre-X, no new waiting periods, and the benefits start over. And that means their copays start over, and so do the benefit maximums. Their out-of-pockets also start over as well. We have plans that utilize national networks. We have plans that don't utilize national networks or open access. We have simplified underwriting. All the short terms have simplified underwriting, right? That's not a big deal. But what is a big deal to us is that we have no rate ups. So if the rate that you quote is the rate that it's going to be at the end. We don't ask smoking if you smoke or not. We accept hypertension as long as it's controlled. We don't ask for social security number. You have to have lived in the United States for this past 12 months prior to the application. And we accept controlled diabetes, type 2 diabetes, as long as it's controlled by diet and exercise. You can't be on any medication or insulin. Plans have doctor office visit, 100% coinsurance. Point Health, that's that patient advocacy service that I talked about earlier. Basically, they help you before you go to the doctor to try to find a provider that will, you can get the best price for that service. Also, they have a prescription drug. If you need a prescription, you can look up to see the pharmacy that offers that prescription drug at the best price. So to get more out of your benefit. And also, again, on the back end, where if you have a large deductible and a cost goes all towards your deductible, they will help negotiate those out-of-pocket maximums for you. And then we have niche markets that we think that we're really, really successful in. And these are maybe markets that you can think about when you're talking to someone. Student athletes, I had mentioned before, we cover athletic injuries as any other illness. Child-only policies down to 6 months. And then that pre-Medicare market is a big market for us. Excuse me. And then all of our plans have free and unlimited telemedicine, which includes dermatology. And then we're backed, all of our carriers are A-rated carriers. I'm just going to spend a little bit of time on the open access because it is, like I said earlier, kind of our special sauce. And because it works so well, we're able to do some other really great things. And I'll go over that in a minute. But so the open access, which is on our classic plans, our Epic base, and our core, because I said they had First Health Network on the core. Well, that's a passive PPO. So you don't have to use that network. Benefits are same, whether you go in and out of network. It's just the discount that will be different. So no network restrictions. You can go to any provider or any facility. And basically what we do is we pay what we call Medicare Plus. You may hear usual and customary. So basically we say to providers, we're going to pay you 125% of the Medicare allowable, and facilities will pay up to 150% of Medicare allowable. By doing that, the average discount is 69%. Now, a good network, you'll see here on the other side of my slide, the Cigna network, they said their average discount is a 49.8%. I don't know, probably, maybe in the really good areas, but the average discount across all areas, because again, this is open access, any provider, is 69%. So your member is saving money, not only on their premiums, because there's no PPO access fee, but they can save on their out-of-pocket due to the larger discount. And then what we offer is a balance bill protection to every member that is on an open access plan. And we put all the information of this in the fulfillment materials. We do not hide this. We want them to use this if this happens. But if the member gets a balance bill, because remember, we don't have contracts with these doctors. So they're saying, they can balance bill a member. If they balance bill a member, that member can send that balance bill to insurance benefit administrators, our administrator, and they will negotiate that balance bill with the provider and get that balance bill down to where it should be. But the member is not responsible to pay for anything above what they've already paid. So anything above their responsibility, Pivot will pay. So it sounds like, oh my gosh, how do you do that? It happens very rarely. Very rarely do we get a balance bill. It's less than 1%. And it's less than 2%, and then less than 1%, we actually have to pay the provider more. Typically, as soon as you call, they kind of say, okay, that's fine, we'll take what you paid us. So it's a great benefit to the member, though. They don't have to worry about that paying more once the provider gets the payment from the insurance company. Then we have that Point Health advocacy service. Again, if they have an out-of-pocket, that's their responsibility and they can't afford it, they can use this service to help negotiate. And then the Cigna networks, we have two very large national networks for our other products. We have the Cigna network and the First Health network. So by having that, one other thing on the network options, by having the open access with that that average discount of 69%, we're able to keep premiums down. We have not had a major increase since we started. A couple of years, I would say 2 years ago, actually 3 years ago now, we took a rate decrease. The next year, we added benefits. So we added that free and unlimited telemedicine. There was no rate increase besides the normal trend increase, which is low. And so we haven't said, oh man, we got to raise these rates 10% this year. We haven't had that. And we're about to roll out some new features that because of that discount, we're able to roll them out. And there'll be no additional fee, no additional bump in rates besides the normal trend. So again, very valuable to everyone. The ancillary products, again, we have the dental. I had gone over these. It's through Renaissance. There's no waiting periods on 2 of our plans for any services. It's a progressive plan, so benefits get better for the over 3 years. All plans have routine cleans paid at 100%. And our value plan, again, is that 100% preventative, 80% basic. And then you can add vision to all of our dental plans. The Latitude is that guaranteed issue, bundled accident, critical illness, hospital indemnity, and AD&D. There's 2 plans. You have a $2,500 benefit or a $5,000 benefit. And again, these can be added to both our short-term and our anchor plan. So I want to go over the anchor plan real quick. Our anchor plan, that's our fixed benefit plan. So we came out with the fixed benefit plan. Fixed benefit has been in the market a long time, but we wanted to come out with the one that was a little bit different. And why did we want to come out with this? Well, for one reason, we wanted a permanent plan, one that didn't have duration limits. So it could be guaranteed renewable up to age 75. So you can actually buy this product when you're 74 years old if you want. Now, it can't be a wraparound to Medicare or Med Advantage or Med Sup, but it could be a wraparound to Medicare, A and B. So another reason we wanted to do this is because, there's a lot of stats out there, and 93% of members file less than $5,000 in their health insurance claims. I just watched a video report the other day that, with the economy the way it is today, The Federal Reserve reported 36% of households could not pay $400 in unexpected bills. The Kaiser Foundation said the average individual deductible is $1,669. That's 4 times as much as they can afford. And what are unexpected bills? Well, medical bills typically are unexpected bills. Even if they're on an ACA plan, it doesn't mean that everything's paid at 100%. There's a lot of out of pocket with that. So these are great wraparound plans because they're first dollar benefit. They're going to pay for a benefit and they're going to pay a fixed amount no matter what that bill is. So if it's higher or lower, that amount that they say they're going to pay for that service, it's going to pay for that service. So it helps with those out-of-pocket expenses to kind of bring down that, file a claim, get that benefit, and that way it offsets that large deductible. And we wanted people to feel like insurance was a benefit, not that, well, I don't ever file my claims or I file less than $5,000, so I never hit my deductible. I don't really have a benefit with this insurance. We really wanted people to feel like they had a benefit. So, the hospital confinement benefit on these plans increases in the calendar year 2 and 3 on some plans. Our surgery benefit isn't capped or tiered. It's basically based off that it's referenced, it's RBRBS, which is the Medicare allowable. And then our anchor plan blends the illness and injury into one simple, understandable benefit. And then again, we have the point health on this plan. So anchor plan offers predictable and affordable access to health care. No deductibles, no coinsurance before benefits are paid, no overall lifetime maximum. Specific expenses have a fixed amount that will be paid. And when I say paid, this isn't a reimbursable plan. This is going to pay your provider. And so you don't have to file claims or anything like that. All you have to do is show your ID card. They file the claim, the benefit's paid. So it pays for hospital stays, emergency rooms, all different types of services. It also includes inpatient mental, nervous, and substance abuse. So there's extra benefits in there. It has free and unlimited telemedicine. It includes accidental death and dismemberment. There's no coordination of benefits. So benefits are paid no matter what. So whether they have another plan that the claim is going towards their deductible, we don't coordinate benefits. We're going to pay that benefit based on the service. This plan also has access to the First Health Network, so there is a network discount they could get. And again, the Point Health mobile app allows them, the members, to be able to find a doctor to give them the best price for their service. That way their benefit will cover more of that price for their service. So we really like the Point Health on this plan. And then eligibility is 30 days up to age 74 with a guaranteed and automatic renewal to age 75, as long as they pay the premium. So I just wanted to give you an idea kind of the pricing, and 32-year-old, you add the value anchor plan with a short term and a dental, and you're at $300 a premium. 40-year-old, you're at $416. So very affordable, and it's going to be affordable, especially if they're looking at an ACA plan with no subsidies. Just real quick, I want to talk about the pre-Medicare market, because we are very strong in this pre-Medicare market. And why is that? Is because we're providing product options that customize the coverage to fit any budget or any need. And they're paying for benefits that are relevant to the market. They're not paying for maternity. They're not paying for child dental. They're paying for benefits that they're going to be able to use. They like the open access because it goes where they go. They're snowbirds. They can take it up north. They can bring it back here. And then it's flexible. So it goes from 30 days all the way to 336, 3 by 364 to get them to Medicare. So who makes this market? Early retirees. 9% of Americans aged 50 to 64 are enrolled in non-group market. I told you before, 30 million baby boomers left their jobs during the pandemic. They were done. And they're not just leaving their jobs and doing nothing. They are leaving their jobs and doing what they're passionate about, what they've always wanted to do. And that's that gig worker again. If you sell Medicare and you're talking to a Medicare recipient and they said, great, thanks, this Medicare plan's great for me, but do you have anything for my spouse? They're only 62 or 63. This is a great option for them. You're going to see that we are the most competitive on a spreadsheet in this market. And then again, I had talked about the baby boomer generation. 10,000 people turn 65 every day. Well, they're also turning 62, 63, 64 every day, and they will for the next 8 years. And then people delaying retirement because they have a younger spouse. Give you an idea of why this is such a big market for us. 25% of our membership is within that 56 to 60 plus market. Year over year, that 60 plus market increases for us higher than any other age segment. So we like this market, and we make sure that we're competitive in this market. So what's that mean to you? Well, it means that you can get a better commission. You can get a better commission on a short-term medical plan than you can an ACA plan. So if this person is not getting a big subsidy or a subsidy at all, short-term medical is a great option for them and for you to kind of build up your revenue. And then if you are selling Medicare, what's your biggest expense? I bet you it's leads. Well, 50% of 63-year-olds are already looking at Medicare options. If you can provide them with an affordable plan when they're 63 or 64, they're going to look to you for that Medicare option. So, and then you're building your book of business with competitive pricing and products so that your best lead source is going to be your book of business. So just real quick, I kind of wanted to show where, Pivot is as far as sales, and then what we're seeing from your distribution. And when I say your distribution, I'm using National General as the full distribution. So all that goes under that. So you'll see our age segment pretty close. Where we sell more is under 25 than you all sell. And again, we're very, very competitive in the college arena. So college athletes and college students, they like our plan, and we sell a lot of our plan there. And then you probably sell more of that 36 to 45-year-old. You're probably selling a lot of gig workers, 46 to 55. People have left their job and they're doing what they want to do. So that's great. And our products are super for that market. This kind of gives you the plans that are the best, that we see are the highest selling plans by age segment. So you're selling, if you look at the that younger generation or those younger age segments, you're selling that core plan. That's exactly what we made it for that younger segment. Choice plan, you're going to see choice splattered throughout the whole matrix because it's a great plan and it's priced, very competitively. The Epic Base plan, we sell 90% of Epic Base over Epic PPO, and because of pricing and because people like that open access. Durations, pretty close, same that we're seeing, 180 day is our top selling plan right now, which makes sense. But 364, again, very close. And then 3x364 is pretty high as well. And you are basically the same. And our 90-day plans are right at the same time. So, duration it's a very good mix. Our top states, very close to yours. The only thing that we have different, I think, you have Nevada as one of your top states, and we have Nebraska. And if you do sell in Nebraska, we have all of our plans available there. They're all 3x364. So that's a great market for us. Before I leave, I just want to give you a little bit more incentive to sell our plans. If you haven't sold any of our plans yet and you're not contracted, make sure you reach out and get that contracting paperwork. If you sell 3 plans after you're contracted until the end of the year, your first 3 plans, we're going to pay you on those first 3 plans. If it's a 364 short-term or a fixed benefit plan. So we're going to pay you for those first 3. Then every quarter we have a bonus. So those 3 plans can go towards whatever quarter bonus that you sell in as well. So you'll see here we pay kind of by product and by duration for short term. And this is, it accumulates. You have to sell 5 medical plans before it starts paying back to the first one. And we do pay, typically it's about 90 days after the contest is over, because we look back and make sure it stayed in force for at least 90 days, and then we'll pay out. So, but you can earn on every policy because we pay back to Act 1 after you sell 5. There's no registration or anything like that. You're automatically, as soon as you sell, your plans are included. So that's all I had. I hope that helps position the Pivot Health products within your portfolio and for your clients in this upcoming open enrollment.